Ultrasound is one of the most ubiquitous, universal aspects of North American and really global prenatal care. But is it safe? And is it really useful? Ultrasound encapsulates so much about obstetric culture and birth culture, and I think its use reveals a lot about how we see birth and the values that we express through how we do birth as a society. I'm Yolande Clark. I'm a birth educator and birth consultant, and I'm the author of the Bauhauswife blog at www.freebirth.ca. I'm the Director of Education and Communications for the Free Birth Society at freebirthsociety.com, and I just released parts 1 and 2 of my 3-part podcast series, Unpacking Ultrasound, on the Bauhauswife podcast, available on iTunes. What I've found over the past 18 years of research on the topic of ultrasound is that despite the fact that ultrasound is billed as this amazing technology that allows us this profound insight into our developing babies and which enables us to ensure that our babies are safe and healthy and that supposedly prevents all sorts of issues, ultrasound is actually far less helpful than we're led to believe. And in fact, it carries a risk, significant risk to my mind, enough that I've chosen to never ever expose my babies to ultrasound technology, and that includes the Doppler. The risk that ultrasound poses might actually come as news to you as well, because those risks are almost never discussed by nurses, by obstetricians, by gynecologists, or by family doctors. So I'd like to invite you to try on a little thought experiment. So let's say a young woman finds out she's pregnant. She shows up at her doctor's office for her first prenatal appointment, as she's supposed to do, and the doctor says, "Congratulations, Cindy, you're pregnant. I bet you can't wait to see your baby. So just lie down here, and I'll set up the ultrasound machine, and we'll take a look, and we'll make sure your baby's growing properly and is healthy. How about it?" Now here's another scenario. Cindy walks into her doctor's office, having just found out that she's pregnant, and the doctor says, "Congratulations, Cindy. I'm so happy for you. I suggest that you try your best to eat well, that you spend lots of time in nature, tuning into your body. Do you have lots of support in the way of friends and family? That's great. Good nutrition, self-care, and a loving community are the most important aspects of ensuring that your pregnancy and birth go well and that your baby is healthy. Now," says the doctor, "I also have an ultrasound machine, but before you decide you'd like to receive an ultrasound, I have to inform you that ultrasound has never been proven to be safe. Ultrasound has never been put through double-blind control trials, but what we do know definitively as a science community is that ultrasound damages cells and modifies cells. It changes the way cells develop. In animal studies, ultrasound has been correlated with neurological problems, low birth weight, and miscarriage. And no, we're not mice or rats, but the mammalian reproductive system is remarkably similar across species, and tissues and cells respond pretty much the same way whether you're a goat, or a mouse, or a human being. Ultimately, whether or not you have an ultrasound will offer you no statistical improvements in terms of the likelihood of whether or not your baby will be born healthy. Even in regards to potential problems like placenta previa, whether or not you have an ultrasound will not statistically lower the chances of adverse outcomes. But it will give you a fuzzy black and white photo of a shape that kind of looks like a floating baby blob. Although every time I've ever performed an ultrasound, it's pretty clear that babies frantically swim away from the high-frequency sound waves that the machine emits, which on its own certainly might give a mother pause. But what do you think? Now, the reality is that that latter scenario almost never takes place. And yet, everything I described therein about ultrasound is true. But despite these lovely concepts like informed consent and the right to refusal, how is it possible for women to really make an informed choice about ultrasound or anything else when their doctors are not transparent or honest or accurate about the information they're sharing with their patients about the possible risks of any given procedure? The answer is that it's not. It's not possible. And I've noticed that the entire paradigm of our medical system is predicated on strong internal biases. And the result is that mothers and babies may be making choices. Mothers may be making choices in the absence of the full scope of information. And that's not informed consent. So if you're interested in delving into the myths and facts about ultrasound and hearing my own ideas as to why ultrasound is so important to the obstetric industry and so emblematic of obstetrical care, please subscribe to the Bauhauswife podcast on iTunes, where I explore as deeply as I can all of these issues and conflicts and my own philosophy of how to optimally approach pregnancy, prenatal care, and birth, and free birth, and lots of other things too. And you can find out more about the work that I do at freebirth.ca and at freebirthsociety.com. Thanks so much for listening. Take care.